My name's Tisa. I'm a registered nurse. I started this health education series with the aim at giving people the information they need to stay healthy and prevent disease and to understand their own bodies. So today we're going to be talking about inflammation. Inflammation is a really important process in the body. It helps us stay healthy. It also helps us actually build muscle after exercise, but it's also the base for a lot of the modern diseases that are plaguing us right now. So what is inflammation? Inflammation is the body's emergency response system. It's the first response to any tissue injury or the presence of pathogens in the body like viruses or bacteria. I want you guys to think about inflammation like if your body was a town, and in that town, each building has a specific function. And in each building, there are all these red buttons on the wall. And lots of different stuff can set off the red buttons. And when those buttons get pushed is when you initiate an inflammatory response. So the thing about this response is it's the same no matter what sets it off. The only difference is going to be how many buttons are pressed. So it could be like a large inflammatory response or a small inflammatory response. But it's what we call a non-specific immune reaction. So it's not having to do with whether you were scraped by a nail, or if you caught a cold, or if you had tissue damage from something going on inside your body. So the inflammatory response is designed to contain whatever pathogen, like a virus or bacteria, that may have caused the inflammation. So that's why you see the swelling, is because it's containing in a localized area whatever problematic thing caused the inflammation. It's also the first step in tissue healing. So I'm going to get into the process of inflammation in a minute, but basically the end result of inflammation should be that the resources that are needed to actually repair the tissues are brought into the area, and that process of repair is started. But there are some ways that can go wrong. Do you guys have any questions about what is inflammation? Alright, so we're going to move on to the actual process of inflammation. And I'm going to use this metaphor of like your body is a small town, and then kind of relate that to what's happening physiologically in the body in more anatomical terms. So I want you guys to pick one of the buildings in the town of your body, and that's going to correlate to one of your organs. And imagine something setting off those red buttons. So maybe it's like an active shooter, maybe there's a fire in the building, maybe there's a chemical spill, some pipes are bursting, and there's a spill. Something's setting off that inflammatory response. The first thing that's going to happen is that area of your body, or that building, is going to be designated as a hotspot. And all of the roads surrounding the building are going to be just green lights, and the traffic is going to increase on those roads. And that's to bring the resources needed to respond to the inflammation to that area. So the inflammation is triggered, the building's now a hotspot, and we've got all this traffic. So resources are being brought into the area, and in fact so many resources are brought in that it's going to be hard for anything to come out. And that in the body correlates to the swelling of inflammation. Fluids are coming into that area, white blood cells are coming into that area, and the area is becoming swollen and red and hot. From the open roads and the open doors, the first responders to the inflammatory event are going to arrive on the site. And those first responders are called neutrophils. and their job is to neutralize whatever caused the inflammation. So they're kind of big guns. They come out and they're just kind of destroying everything in their path. They're coming into the building, and regardless if it's the thing that actually caused the inflammation or not, they're doing some damage to it, because that's their job. And in the body, that's the neutrophils come in and they release chemicals that are free radicals. They're chemicals that cause damage to the environment and damage to whatever pathogen, like a virus or bacteria, that came in. And they do so much damage that these first responders actually die on site. And that's when the second responders come in. The second responders are the macrophages. In Latin, macrophage means big eater. And macrophages are like the cleanup crew. They're basically coming in with their bags, and they're just picking up the stuff. They're picking up all the debris that was caused by the whatever initiated the inflammation and the first response to the inflammation. So they're bagging everything up. And as they go along, if they see anything that they think like, hey, maybe this is the thing that caused the inflammation, they're going to grab it and they're kind of going to hold on to it. They're not going to put it in the bag, but they're going to be like, maybe it's this. And the macrophages they're not that smart. They can't tell the difference between what's your own tissue, so this is my drawing of a muscle, and what's something that could have actually caused the inflammation. So this is like bacteria. But what they're going to do is they're going to take it and they're going to bring it over to the more sophisticated parts of your immune system and say like, hey, do we need to respond to something like this? Do we need a specific immune response at this point? And then, so that would be these like cleanup crew, they're like going to their supervisor. They're saying like, hey, this is what I found. What should we do? And so hopefully you've got a smart immune system and they say like, okay, we're going to make some antibodies that are going to specifically kill these bacteria. And we're going to leave our muscles alone because we don't want to attack our own muscles. So that's what the second response is. It's kind of cleaning everything up, and then it's taking these bits from the area and helping the immune system decide, do we need to launch a specific response? And that's how the body ends up clearing like viruses, is like the antibodies that we develop from that. And so the third responders are the repair crew. The repair crew is going to come in after the macrophages, and these are called fibroblasts. And fibroblasts, their job is to patch up the damage that was caused by whatever caused the inflammation and the body's own reaction to it. So they come in and they're just going to do a real patch job. Like the building where the inflammation happened, it has a really important job to do. And so they can't spend a lot of time like on the repairs. They need to just get everything working again so that it can go back to its job. But so think about like there's something called like fire caulking that they can use, where they're just patching everything up. And in the body, that's the laying down of scar tissue. So if the fibroblasts are just laying down scar tissue to patch everything up, and then under normal circumstances in a healthy body, you enter the phase of remodeling, which is where bit by bit the fibroblasts kind of take away the scar tissue and normal healthy tissue is put down in its place. Alright, so that's an overview of the process of inflammation. Do you guys have any questions about the process so far?
So Tisa, the longer it takes for your body to go through these steps, the worse the inflammation is. If it's a light inflammation, it goes faster, or is it a time? How does that work?
So if it's like so you're asking like if it's a stronger inflammation, does it take longer to get through the process? It probably does.
Okay.
You know, if you just have like a little hangnail, you might have inflammation that only lasts for a day.
Right.
Whereas, if you contract like the flu, then you're gonna have inflammation that lasts for 7 days. And it's as long as the process is still happening in an orderly way, that's not necessarily a bad thing. But I'll talk about this more later. When if the process becomes like disorderly, like we've got fibroblasts, we're trying to lay down new tissue at the same time as neutrophils are still like spreading the noxious chemicals, then we have a problem.
So this is the idealized process.
This is the idealized process in
Okay.
a healthy
Just
body.
take your time.
Alright. That was a good question. Do you guys have any other questions about the process?
You mentioned scar tissue, and then you said as part of the repair process, eventually the scar tissue would be replaced by new tissue.
Yes.
So when we say scar tissue, I thought that meant the tissue that is made to replace injury, and I thought it was kind of a permanent thing. It's never as good as the real tissue, but it's actually a temporary thing.
It's supposed to be temporary.
Like a scab.
Yeah, it lasts longer than a scab, but the scar tissue is there for the initial repair. And then ideally, eventually it does degrade. The body has enzymes. Scar tissue is made out of collagen, and the body has enzymes that break down that collagen so that more normal tissue can be laid. But if you imagine, if you're in a body or in a town where these alarms are just going off all the time, you probably don't have the resources to actually go back through and take down the scaffolding and put, put healthy functional tissue.
So it's quick.
So the scar type tissue is laid down quickly. And there are some things that encourage scar tissue to be reabsorbed, like massage and movement, help tell the body that tissue should be replaced by different sort of tissue. Other questions? So I just did an overview of the events of inflammation, but what I didn't talk about was all of the signaling that happens that coordinates these events. So the whole event of inflammation, as well as the process by which inflammation is resolved, we say it's mediated or it's controlled by chemical signals between cells. And so it's kind of like a language spoken between the first responders, but it doesn't have as many words as the English language or sign language or other languages we think about. There's maybe a few dozen or 100 different chemical signals that are conveying the messages. And so between the first and the second responders, there are chemical signals that say okay, there's chemical signals that attract the neutrophils or the first responders to the site of inflammation. And then when they're done with their job, they send other signals that say, hey, we need some backup, we need some macrophages to come down. The chemical signals, they go to the cell and they bind to the surface of the cell, and then they tell the cell how to behave. So they tell them what genes to transcribe, and what they should be doing in the area. Some of these signals are kind of localized between the cells, but some of them affect the rest of the body. So I have this person here. He's going to be our person experiencing some inflammation. The body is 70% water, and these inflammatory signals, they go everywhere in the body. So here I have, we call them pro-inflammatory cytokines. I'm going to drop them in. He's having a cold. And they go through, and eventually they actually to go into his brain. The signals of inflammation cross the blood-brain barrier, and they cause some of the feelings we have when we have a lot of inflammation in the body. When you have a cold, for example, the signals of inflammation make you tired. They might give you a fever. They cause what we call malaise, which is just feeling kind of crappy. And all of that is happening because these signals from the site of inflammation, it might have started all the way over here, but it travels into your brain. And it's causing those symptoms. And so the reason why you feel like tired and like your body just generally hurts when you have a cold, that cold is hopefully localized to your lungs or to your chest, or to like your nasal passages. But the signals from the inflammation are going into the brain. And over time, like this is important because we're starting to find that there's a real relationship between chronic inflammation and depression. People who have depression have higher levels of these inflammatory signals circulating throughout their body. And in fact, if we just take a person who doesn't have depression and we give them those inflammatory signals, they experience the symptoms of depression. So having depression is a signal that there's probably some inflammation in the body. All right, do you guys have any questions about cell signaling and inflammation? So how does inflammation impact health? Inflammation in the short term, what we call acute inflammation, is very important and it's very helpful. The reason why if you have like a sinus infection, your sinuses are all blocked is because it's stopping the bacteria that's causing the sinus infection from getting into your bloodstream. A bloodstream infection is called sepsis, and it's a life-threatening event. Somebody's in the hospital. If somebody's already in the hospital and they develop sepsis, that's like an emergency within the hospital. And so it's serious. And inflammation is the thing that kind of walls everything off and says like, okay, we're gonna just battle with this pathogen in this area instead of letting it get to the rest of the body. Inflammation also, it initiates the healing. Like if you have a cut and you're on strong anti-inflammatories, it's going to take the cut a lot longer to heal because it's the start of that process that results in new skin being formed. Inflammatory signals in muscles also signal the muscles to grow larger. So people who are on strong anti-inflammatories also won't have as much muscle growth, and that can be an issue. So the problem is when inflammation goes on and inflammation becomes chronic. We're finding now that inflammation is involved not only in depression, but also our number one causes of death in the United States, like heart disease and cancer. Inflammation seems to promote the buildup of plaques in coronary arteries, which lead to heart attacks, and it also makes a person more prone to cancer. Arthritis, the leading cause of disability, is caused by chronic inflammation. So chronic inflammation happens when either the process of inflammation becomes kind of disorganized. So we have multiple stages of inflammation happening at once. When the neutrophils come in, they're causing tissue damage, and tissue damage in itself can trigger inflammation. And so if they're not sending the right signals to the rest of the process, then it can kind of cause the inflammation to just keep rolling. Chronic inflammation can also happen when whatever's causing the inflammation isn't going away. So we'll talk about that more in a little Do you guys have any questions about that last section? So let's talk a little bit more about what causes inflammation, especially what causes chronic inflammation. So we know that microorganisms like bacteria cause inflammation, but we also know that microorganisms in the gut and in the nose and the mouth are tolerated by the body. They're called our microbiome. So on the one hand, they can cause problems, but on the other hand, we actually need them. So microorganisms in the gut are especially important for communicating with our immune system. Having a good diversity of microorganisms in the gut, especially during childhood, helps prevent autoimmune diseases because the microorganisms are communicating with the immune system and helping the body tell the difference between self-tissue and pathogens. Those microorganisms are also taking up the space that harmful organisms could take up, so they're kind of out-competing the things that would try to like eat our flesh and stuff like that. But the microorganisms in the gut are only helpful when they stay in the gut. And that's kind of a complicated, it's a difficult problem. Like, how do we keep the insides of our intestines from entering our bloodstream when we need to absorb nutrients from the inside of our intestines? Under normal circumstances, the cells comprising the lining of our intestines are really close together. Here I've got, so this is an intestine, and this is the inside of the intestine here. So normally all these cells are really close together, and they're only letting through the tiniest nutrients. But under some conditions, these cells become further apart. And when they become further apart, bacteria and pieces of bacteria can come from the inside of the intestine into the bloodstream. And this triggers inflammation because the immune system now sees, oh, these aren't bacteria that are inside of me that are good, these are bacteria that are in my bloodstream that I need to respond to. And so, what causes, we call this, when the cells become further apart, we call this increased intestinal permeability, or some people call it leaky gut. And this can be caused by an imbalance of bacteria in the gut. When there's too many bacteria that are like feeding on the mucus in the gut, and not enough bacteria that are feeding on fiber from our diet, we can have those bacteria can start to irritate the cells here and cause an increase in the permeability. Inflammation itself can also cause an increase in the permeability, and so this can become a chronic cycle where you have increased intestinal permeability, you have bacteria and bacteria particles going into the bloodstream, and that's causing inflammation, and that's causing increased permeability. So that's one way that chronic inflammation can perpetuate.
I have a question about that.
Yeah.
You said inflammation itself can cause the impermeability in the gut. Is that like inflammation in the gut can cause that, or systemic inflammation somewhere else can cause it?
That can be systemic inflammation somewhere else. If it's a high enough magnitude. They've also found that psychological stress increases intestinal permeability. That's one way that psychological stress causes inflammation that we've been able to understand. Alright, so you guys have any other questions about the intestinal permeability? Alright, so the other thing I talked about causing inflammation is tissue damage. And tissue damage can be really obvious, like a cut or a scrape, but tissue damage also happens inside the body. And it can be the result of kind of chemical damage from free radicals. So free radicals are molecules that are highly unstable, and they want to steal electrons from wherever they can find them. So you've got these free radicals going around your body, and they steal electrons from the proteins on your cell membranes and from your DNA. And it's causing this instability in the cells that can be read as tissue damage. You know, those cells can put out signals saying like, okay, like somebody needs to come take care of me, like I'm dying. That's what the free radicals do. And it's normal to have some amount of free radicals in the body. The way that our cells turn nutrients into energy generates some free radicals. And cells also have ways of generating antioxidants. So we have the antioxidants we eat and the antioxidants that are generated by cells. And those antioxidants kind of have an extra electron, and they say like, oh, you're an unstable molecule, let me give you your electron that you need before you go and cause damage somewhere else. And so we have an innate defense to the free radicals, but they can get out of control and cause chronic inflammation. This happens, somebody has like a really high amount of sugar in their diet, that can cause extra free radicals to generate. Process, would you say?
Oxygen deprivation.
Oxygen deprivation. Yeah, so if you have an area of your body that doesn't have very good blood flow, when cells are in an environment where they don't have enough oxygen, the way that they make energy generates a lot more free radicals. And that's actually part of the cell signaling during exercise that causes eventually like the muscle growth. But if it's happening not because of exercise, but because maybe you have diabetes or heart disease, and there's an area of your body where the blood vessels are impacted, then you're having inflammation, maybe coming from your feet because your feet aren't getting enough oxygen, and so they're sending inflammatory signals back into the body. And even though blood flow causing lack of oxygen can generate the signals will still eventually reach the rest of the body. It's just that we need more oxygen in a shorter period of time to keep ourselves, functioning in a healthy way and not generating extra free radicals. It can also happen in the case of arthritis. If you get a lot of scar tissue around a joint, that scar tissue is going to impair oxygen from getting to the inside of the joint. And so then you end up with chronic inflammation because there's inflammation happening inside the joint, but it's not getting enough oxygen, and so it can't repair the damage as well, and it's generating more free radicals that's causing more inflammation.
Is that oxygen deprivation real about COVID?
Yeah.
And is this like one of the things that might be going on with all COVID? This kind of inflammatory response from having this and not having oxygen?
Yeah. When you have a strong enough inflammatory reaction, most people have a risk of developing some chronic inflammation from that, from the increased intestinal permeability or from scar tissue being laid down. And so once you have that chronic inflammation, then like some of the symptoms of long COVID are like brain fog. Brain fog is a symptom of inflammation in the brain. With people and kind of maintaining a relaxed but sympathetic attitude when you're spending time with them, like not bringing like a lot of stress or being like, oh my god, this is so bad, like what are we gonna do for you, but like, hey, like I'm just here spending time with you, like that can be helpful. Encouraging encouraging movement, like going for walks with them, taking them to like, movement classes, like yoga, I think it's safe to do like light massage, if somebody has arthritis, just putting hands on the joint, just like warming up the area with your hands, or putting like a heat pack is helpful. And a light massage is going to help circulate the fluid and reduce the swelling. Preparing meals with whole foods, including spices that are anti-inflammatory, like cardamom or turmeric and pepper, and alternating heat and cold. Cold can be really helpful for like the immediate inflammation, and then heat is better for like chronic inflammatory conditions. And they've actually also found that like sauna use decreases inflammation. So if someone's like not in a place to actually exercise, you can get them in a sauna or get them in like a hot tub or a hot bath. The body produces like heat shock proteins, which help protect against inflammation. So this was all general information about inflammation. It does work a little bit differently depending on where in the body it's happening. So if you guys have any questions about the content so far, like any questions are good. And if you have a question about like what the inflammation process is for like a specific organ and what we can do for that specific organ, I'm happy to talk about that as well.
I'm curious on inflammation surrounding food allergies, itchy jaws, and like just like scratching on the face, and how that interacts with all things.
Yeah. So my understanding is that the increased intestinal permeability also kind of predisposes a person to food allergies. We're not meant to have big proteins from our food in our bloodstream. And under normal conditions, you're only absorbing like an amino acid or two at a time. Like you're breaking down the proteins before you're taking it into your blood. When the intestines are more permeable though, these larger food molecules can get into your bloodstream, and that can cause an immune reaction and lead to food sensitivities. Basically, your body, like your white blood cells, don't develop antibodies towards a specific thing until they've been shown it. So, or not, say this was like a piece of whey protein, like your body's not going to develop an allergy to it unless it's gotten into the bloodstream and then interacted with an immune cell. There are immune cells in your gut that it could also interact with, but it's more likely to happen if you have like the intestinal permeability. And some people find that if they're able to resolve the intestinal permeability, that it helps with food sensitivities. ginger is definitely one I recommend to take alongside probiotics, like you take ginger prior to the probiotic. That's like I haven't read particular research on this, but theoretically that's going to shock the bacteria and kind of make them less active for a period of time to give more of a window for other bacteria to establish.
Following up with prebiotics.
Following up with prebiotics, yeah, it's the bacteria that you don't feed aren't going to multiply, and so you want the bacteria that's eating fiber in your diet, and you should be eating fiber with every meal. Like, not a matter of like taking a fiber supplement once a day. It's a matter of like getting a wide variety of different fiber sources, and eating them with every meal. Fasting is also a thing that can both help with the intestinal permeability. Fasting also helps with inflammation in general. When I worked in the hospital and people would come in with like severe gastrointestinal inflammation, that was the first thing we would do, would be to just have them stop eating, because there's a lot of ways that it lowers inflammation, and it refocuses your immune system. My dad uses fasting to treat rheumatoid arthritis, because it actually decreases the specific white blood cells that are responsible for damaging the joints. It doesn't just decrease all white blood cells, but it does affect those particular groups.
So that's why the food is possible to see. Get me
That
stop.
again, no.
How long of a period, or what's like a normal fasting schedule period of time?
I mean, you get a benefit from fasting, even just from fasting for like 14 or 16 hours, giving your gut like a break in time, is a good way to fast. Just to stop eating at a certain time and then start eating again. From the research I've done on fasting, it's very safe to fast for 4 or 5 days at a time. You start getting inflammatory benefits like after 16 hours, and those just continue throughout the time of the fast. At a certain point, you run into the risk of repeating syndrome. And depending on your medical condition, it's like it might be better to have like a medical person supervise you while you're fasting. But it's pretty safe. Honestly, it should be prescribed by doctors as like a response to inflammation and a response to like a lot of problems. But it's just not commonly used. There's people who have fasted like for up to 30 days and been all right, but that was in like a supervised environment, and definitely not something you want to try on your own. I would say up to 5 days is pretty safe to do on your own.
The supervision is where we're coming off the fast.
Yeah.
But like, okay, I'm fasting, I feel great, okay, now, tell me what to do.
Yeah, the repeating syndrome comes from introducing nutrients too quickly, and it can cause electrolyte abnormalities, which can stop your heart. We worry about.
And there is a point somewhere, where it is a couple of days, but it's going to be start to be really hard. Right?
Yeah, there's the,
And then if you get past that, then you're fucked.
your,
Super fast for 4 days.
your metabolism shifts at that point. Because your liver holds on to excess glucose in the form of glycogen. And so when you first stop eating, there's the circulating glucose gets eliminated pretty quickly. But then
You get hungry.
but then your body starts pulling off that glycogen, and so it's still doing the same metabolism stuff. It's just telling you to eat food, even though it still has the glycogen to through your glycogen stores, then your metabolism really has to shift, and that's usually that point, and that's different person to person depending on how much you're holding. But yeah, the study that I saw on resetting like immune system stuff with fasting was saying 3 days was the minimum, and in general, what I've seen is like the minimum effective fast is like 16, 17 hours. But yeah, how much you get out of it is depending on where you start. Like if you do the 3-day fast and you don't build up the glycogen stores again, then you can get through that pretty quickly.
And
Just fast again.
And I've seen patients with diabetes who are like, a day and a half into fasting and their blood sugar is still like over 200 because they just started out so high. Normal blood sugar should be under 100. You guys have questions about any like specific organs that can be affected by inflammation? I mean, any organ can be affected.
Can memory be affected by inflammation?
Yes. Exactly how. Yeah. So the inflammation, like, it definitely goes in the brain, and your like your neurons have some built-in protective mechanisms, but how well protected they are depends on a lot of factors. And so, when they're in this inflammatory, like my understanding is that the inflammatory signals from your body trigger inflammation in the brain itself. And inflammation in the brain itself looks a little bit different because you don't have the same types of white blood cells in your brain as you do in the rest of your body. But you have a similar sort of response. You have your neurons and you have cells that are helping your neurons called microglia. And some of the microglia, they say that they get activated. And when they get activated, they switch from being in a mode where they're protecting the neurons, creating the specific chemical environment that they need to operate functionally, and they switch into trying to contain pathogens, even though in this case there aren't any pathogens in the brain, but they're still doing a similar thing as the neutrophils do, like the first responders to inflammation. They're secreting chemicals that are free radicals and harmful. And so, your neurons hopefully have their own antioxidants to protect them. But if they don't have enough or the inflammatory response is so high, then they can die. And while this is happening, people experience brain fog, and it's a lot harder to access memory. And there's fortunately a lot of these herbs too, they cross the blood-brain barrier and they have similar effects. They found even just I didn't expect to find this, but aromatherapy has been shown to be effective to help protect the neurons. Like sage oil, lavender, and rosemary have been shown to add an additional layer of protection for the neurons. And there's other constituents that kind of help tell the microglia to go back into their normal repair mode rather than the activated mode.
Oils or things helpful after the fact, after it's already been shown and help restore it?
Yeah, and there's more of that from exercise. And there's some herbs that are pretty good for increasing the neuroplasticity, basically. What we always use polygala. It's great.
Yeah. Polygala, polygala attenuifolia. That was one of the top 10 most used Chinese medicines. Pretty widely used. Has a lot of benefits to it. The other thing I would say as far as like what it looks like in your brain with the inflammation is that the higher stress levels on your neurons causes a breakdown, it's not just neuronal death, but also breakdown of the shielding that they have on them, the myelin sheathing, which is like the insulator on an electrical line. Like you can send signals through just a piece of copper wire, but it's going to be lossy, and if it's close to anything else, it'll cause short circuits. And so as you have longer states of high levels of inflammation, that sheathing breaks down. And so some of the inability to access your memories and things comes from that, just like signals being short-circuited and lost because that sheathing doesn't allow it to get to where it's supposed to go. And omega-3s are one of the main building blocks in rebuilding that